Susan. My name is Ashay. I'm going to be performing a bed bath on you. I've brought all of my equipment. I have washed my hands. I have put on my gloves. Okay, we're going to make sure that her bed is raised. I have my basin of warm water. I would have assessed the temperature of this water using my wrist, washing her face first. So we've got the warm water, clean it. We're going from inner canthus to outer. Okay, switching the size of the towel. Okay, I'm cleaning the rest of her face, her neck. I'm switching the towel now. Going to provide maximum privacy by putting on a bath blanket. And then now we're going to do her hands. Okay, then we're doing her armpits. All right, I am switching the towel. I'm going to do her chest, making sure that I clean underneath the breast, and also making sure that I pat it dry with the bath blanket because we don't want any moisture to stay underneath her breast. And then I'm cleaning her abdomen, cleaning inside of the belly button. All right, that's done. With her bath blanket still on, I'm going to go ahead and wash her legs. We're going from her feet up, making sure that we're lifting the legs, cleaning in between the toes. We're making sure that we're not going to put any lotions in between her toes. And if I needed to, I would lotion her. Now we're getting a new towel, and then we're going to wash the perineal area. If this were a male, I would obviously have on gloves and not be touching it this way. But I would take and pull the foreskin back. I'm making sure that I'm cleaning that area, and then I'm also cleaning the shaft and then the scrotum. Okay, that's if that were a male. If it were a woman, we would start with the sides of her leg, the groin, switching it around, and then we're gonna switch the towel around to a cleaner surface. Then we're gonna clean the inside, the labia. I'm gonna change my gloves because I've obviously touched some pretty dirty places. I'm gonna change my gloves, and now we're going to do an occupied bed change. The way that I do this is I start by taking off the sheet. In this case, she would have on a bath blanket, or actually we would put on her gown at this point because she is now clean. So we're going to put that gown on her, and then we're going to prepare to change her bed. So I'm going to start putting this on. Make sure that this is enough for you to catch. I'm going to roll it this way. No, you don't have to lift her up yet. The reason why is because I'm just putting this here that way. And we want to make sure that whenever we do this, that there are no wrinkles, and then we put the chuck. So for the chuck, it's going to go about right here. Now, I have already changed my gloves, and we are going to roll the patient over at this point. That way I can clean her back. So we're grabbing the shoulder and the hip. Okay. I have a new towel. It's nice and clean. I'm going to wipe her back. Then I'm going to wipe. Now, if she were soiled, I would actually use a toilet paper to actually wipe her first, and then I would use the towel. Okay, that's clean. changing the gloves really quick because I may have touched some poop. And then we are rolling this underneath her and putting her new blankets under her. And we're just making sure that there are no wrinkles because we don't want a patient to have wrinkles. All right, Miss Susie, you're gonna feel a hump whenever you turn over, okay? Kind of, we're gonna roll her over. 1, 2, 3. And we're gonna bring her this way. 0 wrinkles. No wrinkles. All right, and then, all right, Miss Susie. How was that? That was good? Okay, great. Miss Susie is all clean. She feels great. So now what we are going to do is just Miss Susie's bed. We want to make sure that she is sitting up comfortably. I'm going to put the bed a little bit lower, then we'll lower it completely at the end. Okay, we're going to make this miter corner. And the way we're going to make, I don't know if you can see me, but the way that we're going to make the miter corner, we're just going to bring this over a little bit. I'm going to raise the bed. Make it look like it is folded. Tuck it underneath. Bring this corner up. And tuck this. Drop the bed. And there is our mitered corner. So, is that it? So, now that we are completed with this miter corner, we're going to make sure that her bed is in the lowest position. Her collar is in place. There you go. I'm going to wash my hands, or I'm actually going to clean up the mess, wash my hands, and then document. Hello, my name is Lachey, and I have my patient here. We are going to be performing oral hygiene care. So I'm going to start by introducing myself. Hello, Zaylin. My name is Lachey. I'm going to be brushing your teeth for you. I'm going to start by washing my hands, placing my gloves on. I brought the supplies that I need. I have the basin, glass of water, toothbrush, toothpaste, and napkins. And act like this is a cloth. All right, so I've washed my hands. I have put my gloves on. I have all of my things. I'm gonna start by assessing the client's mouth for lesions. Can I get you to open your mouth? Or sores or any redness of the gums. And that looks good. I see a little bit of plaque. That's normal. All right, so I'm gonna place, I need you to sit up like a young man. Okay, I'm going to place a napkin or towel on the patient's gown or shirt. That way we don't.
The shirt.
Okay, yeah, so we placed it. Okay, I'm going to put the napkin. I have my basin here. Okay, I'm gonna put a pea-sized amount of toothpaste. All right. Okay, I'm gonna place the basin under his mouth. Open eye. I'm gonna go in a circular motion. Say cheese. If the patient were able to do this on his or her own, I would just assure that they're brushing in all the hard to reach places. And also, if they wanted to floss, I would bring them some floss. Put your head up, okay? Put your head down. Put your head down. And if you have to spit, you can spit in the basin, okay? That's what I have it for. I'm making sure that I'm cleaning the gums, making sure that I'm cleaning the tongue. Take your tongue out. Open it. All right. Okay. Now I'm gonna make sure that I put my supplies up. Have the patient a little water. Hold on. Wait, don't put it in the sink. Okay. All clean. Okay. Okay. If I were to perform oral hygiene on an unconscious patient, I would want to first wash my hands, make sure that I had gathered all of the equipment necessary, which would be the oral swab, an emesis basin or some sort of basin to catch the fluids, and also a towel or a blanket to place underneath the patient. Then place the patient flat on his or her side with the towel and the basin placed under the patient's cheek. I would open the mouth, I would assess for any sores of any sort, and I would also make sure that there is a suction provided, so that way when I'm providing oral care, that I can get all the excess fluids from the patient's mouth to prevent aspiration. Once I do that, I'm going to start by swabbing inside the mouth, making sure that I'm cleaning the cheeks, the teeth. Also make sure that I'm cleaning the client's tongue, and also while I'm performing this, making sure that I don't see any lesions or any inflammation of the gums or anything like that. Also make sure that I irrigate the mouth with a little bit of water. That way we can rinse it out properly, and then also suction out any excess fluids from there. Once I've cleaned the patient up, I could put a water-soluble lip balm around the lips. I would want to avoid using any petroleum-based lip balms, just for the patient's safety. And that will be the end of the patient care. Once I'm done, I'm going to take off my gloves, wash my hands, put the client's bed back in the lowest position, make sure that I wash my hands, and make sure that the patient has his or her call light, and then I will go and document the care. And that's that. Girl, I don't even know. Girl, is that it?
Yep. Yeah. Mitered corner.
Oh no, sorry. Mitered corner. Okay, and that is the end of this video.
We have that in real life.
Okay. We're gonna edit that part out. And then I have Miss Keisha, who it's okay. Here. Oh my god.
Well, hopefully.